My name is Sandy. I'm 63 years old, and I'd like to tell you about my experience with Intone. I had a hysterectomy about a little over 10 years ago, and at that time I had an anterior and posterior repair. And it was fine for about 5 years. And then about 5 years ago I noticed I was starting to have a lot more urinary incontinence and also fecal incontinence. I addressed this with my GYN. He talked about doing Kegels and also tried a overactive bladder medication, which I did not like. I had a lot of side effects from that. So at that point, he sent me to a urogynecologist to see if I maybe needed to have surgery for this. This is not something I really wanted to do, and she had suggested that I try the Intone first. And after about 2 to 3 weeks with using the Intone, I noticed a greatly improved condition. I was not having to wear pads anymore. I was not having the fecal incontinence. I just felt like I had my whole body back.
I work in an OBGYN practice, and when the Intone representative came into the office to speak about Intone, I knew that was something I was interested in. I'm a person who has had a lot of surgery in the past, and I did not want surgery again, and I felt I was going to have to deal with this problem for the rest of my life. And with Intone, starting out, 10 minutes a day, anybody can do that, is definitely worth it.
In 2007, I had a bladder sling placed for the stress incontinence, which helped that, but it didn't help the overactive. So then I had to take medications for that. It got to be too expensive. Insurance doesn't cover it real well, and was getting the side effects of the dry mouth and things like that.
They put me on a prescription medication. It dried me up, made me more thirsty, and didn't help that much.
I received an invitation to attend a seminar about incontinence. I got to meet a lot of people who suffer with incontinence as well as myself, and it made me feel a lot better. I realized that there was a therapy out there where I did not have to take pills. So I decided to try the Intone, and it has been a godsend. I tell all of my friends that if they're having any kind of bladder problems, to speak with their physicians about using the Intone, to give it at least a try.
I actually had a surgery in 1995, which worked great for several years. Started experiencing more problems, had a second surgery in August of 2011, worked great for a while. Started having problems again, just assumed that I'd be headed for a third surgery. My doctor recommended trying physical therapy. Honestly, with my busy schedule, working 40 hours a week, I just could not find the time to get to physical therapy. I want to get the word out there. I want to let gals know that there's something out there for them, that they don't have to spend the time driving to physical therapy. It's a device that they can use in the privacy of their own home, and it really does work.
I had the bladder surgery 3 years ago, and it did not work for me. So when I first heard about Intone, I was kind of interested, but I was also scared because I already knew the other had failed, and I knew my case was severe, and there was times I broke down and cried because I'm thinking this is as good as my life gets. After the first session, I went to bed and only had to get up once through the night, and before that I was getting up 4 to 6 times a night. I used to go as 20, 25 times a day, and now I'm down to 4 to 5 times. I'm just able to go shopping now, can shop for 5 or 6 hours. It has just changed my life. I now can go to my daughter's house and not have to take 2 or 3 extra pair of clothes. I just cannot thank the Intone enough. I'm so amazed with it, and it's just been a blessing to me.
I just look at the amount of money that I am saving in not having to buy panty liners, because it had gotten so bad that panty liners were almost not cutting it anymore. I honestly thought I was going to have to go to Depends or something heavier.
This is my 7th, 8th week using Intone, and I'm not using any pads now. And I've just been very, very happy with it. I would recommend Intone to any of my family or friends.
Probably after my second daughter was born, just playing around one day on the trampoline and noticed, jumping up and down, that I had some leakage. Didn't think it was any big deal. But several years ago, I noticed that it became more and more of a problem. I thought that surgery would probably be my only answer just because my mom's had the same surgeries in the past. And one of my doctors, Dr. Beverly Wood, got a flyer for the Intone device. It made a huge difference. It's, so easy to do. It's something that you can do in your home, by yourself. It takes 12 minutes every day. You don't have to go to a doctor's office or, do physical therapy or anything like that. No co-payments that need to be made. We see lots of moms that have just had babies or had hysterectomies. We recommend it to all of our patients. I recommend it to my own family and all my friends. I think it's the greatest thing that's come out.
I mean, I know that the upfront cost seems kind of expensive, but when I saw what they were doing, and I just had a feeling that it was really going to work for me, and it did. I can run like an hour without any problem, and it's just kind of giving me the confidence to go out and do what I was doing like 20 years ago.
It's definitely worth the money. I would think that you probably would spend that much money on pads over a period of a year to two that the whole product has cost me.
I realized I had a problem with bladder leakage after I had my daughter. I was 23 years old at the time, and I used to teach dancing, and I noticed that whenever I would jump around, I would leak, and so I started using a pad whenever I would teach dance. And I also enjoyed different kinds of sports. I played soccer, and that was a problem with that. And also just my daily life. If I had to go to the bathroom, I would have to run to the bathroom. And I was young. I didn't think it was a problem that other people had at my age, and I was embarrassed to even talk to my doctor about it. So then I started testing myself after I used Intone, and I decided to sign up for a 5K with a friend, and I ran it, and that was my one big test. I didn't have that kind of leakage that I had. I didn't have that leakage anymore, and no matter what age you are, you should always talk to your doctor about it because so many women have this problem. So many of my friends have this problem at my age, and this device helped me and it worked for me, so I would totally recommend it.
Intone changed my life because before I started using Intone, I wasn't able to do simple things like play in the yard with my kids, jump on the trampoline. And once I've started using Intone, and now I'm able to, run in the yard, play with my kids, and they're able to have their mom back.
I have more confidence of going out, more freedom, not having to worry about, oh my, am I going to lose urine? And I have gotten to the point where I can use the maintenance therapy once or twice a week. I would recommend it to anyone. I am very happy with the Intone.
I would definitely recommend Intone for other women. It's a non-surgical way to get rid of a problem that nobody wants to talk about.
It's just been amazing, totally amazing. And the money I'm saving on panty liners and pads is awesome.
I'm 58 years old and I have stress incontinence. Actually, I think would be more stress urgency incontinence. Always have. It's a neurological problem. So when my friend Monique from Intone came in, I felt very fortunate that I worked for OB-GYN and I signed up happily, started using it, and within 2 weeks, I realized that I could go to a store, do my shopping, and get home without having to go to the restroom. That was the most remarkable thing to me. I'm really excited because in this office I'm the testimonial to all the patients that come in with the same problem, which it's nice to know you can share those problems once you get started with that. So yeah, I recommend it. I recommend it every day. I think we did a good thing. I really do.
I had been celibate for 10 years and I knew I was getting married. I was engaged to get married, and I was really nervous and worried about being intimate with my husband and possibly having bladder leakage. And I was able to do the Intone about 3 months before I got married, and the Intone just really made me feel more comfortable and confident, and that has not been an issue at all. So that's a big bonus.
My husband and I together immediately talked how it felt like it changed my sex life, our sex life together. It made him feel like I was a younger girl down there. Things were tighter and more pulled together. I had more control, and that just continues to get better with each passing week.
Once I started using the Intone device, I started noticing a difference in as little as 2 weeks. After 6 weeks of use, I was completely dry and was able to enjoy the things I used to be able to do.
I started about 8 days before we took a family summer trip to Disneyland. I was able to go through the entire line. I was able to go through the entire ride. A lot of times I was able to get onto the next ride and even the next ride, sometimes 2 or 3 rides before I'd have to go to the restroom. In our previous trips to Disneyland, I would get in line with the family and wait till I was about 15, 20 people back from getting onto the ride, and I would have to sneak out of line, go to the bathroom, run, and hope that they were still in line. And so that was a huge improvement for me because I was able to spend, time with the family in Disneyland instead of running to the bathroom at every possible time.